Thank you, Omar, for that nice introduction. And I thought that was a confidential conversation, but that's okay. Hello and welcome to the 2020 Consumer Workers Forum that the Consumer Peer Workforce Committee, in partnership with Bing, are able to bring together. It is great to see so many familiar faces, and so many new faces as well, from the local health districts, specialty health networks, and the Recovery College. To say that last year has been challenging will be an understatement, with COVID, telehealth, virtual care, new restrictions, rules, the post-bushfire effects, and the ongoing drought challenges in New South Wales. It is a testament to the resilience, strength of character, and adaptability of the peer workforce to manage in this environment. The peer workforce in a recent straw poll at a meeting has over 160 mental health peer workers and over 30 new suicide prevention peer workers, approaching a combined almost 200 peer workers in New South Wales Health. This is a titanic number, not just because there are safety in numbers, but because peer workers can now feel part of a peer workforce with career progression opportunities, specialized roles, professional development opportunities, and a more powerful voice. Due to the effects of COVID, the annual forum, usually held in November, has had to be delayed till today. As a result, there may be several new faces who haven't experienced a Consumer Workers Forum before, or have familiarity with the work of the Consumer Peer Workforce Committee. I would like to take this opportunity to share or reshare the purpose of the Consumer Peer Workforce Committee as defined in the terms of reference. To plan and host the annual 2-day Consumer Peer Worker Forum in partnership with Bing. Support local health districts and specialty health networks to embed contemporary practice, including recovery-oriented practice, trauma-informed care, consumer-led co-design, co-production. Provide support, mentoring, and leadership to the network of New South Wales health consumers, peer workers. Support a community of practice for the diversity of positions that exist across New South Wales Health, including community, inpatient, adult, older persons, youth, senior peer workers, peer managers, peer educators, the peer-supported transfer of care model, and all other new peer worker models that are continuing to exist. And finally, provide lived experience expertise on systemic issues relevant to the public consumer peer workforce with key stakeholders across the New South Wales mental health sector. We hope this year's forum will continue to provide opportunities to strengthen the bonds between peer workers, appreciate the work of other local health districts, specialty health networks, and network with fellow peers in New South Wales. Through the standing seat, bit of an oxymoron, that the CPWC has on the Consumer Subcommittee, the voice of the peer workforce continues to be represented, providing guidance to Ministry of Health, Mental Health Branch, the Program Council, comprised of LHD directors. The Consumer Peer Workforce Committee has welcomed and works closely with the statewide Peer Workforce Coordinator over the last year, has provided guidance on key strategic initiatives, including the Towards Zero Suicide initiatives, as well as the New South Wales Peer Workforce Framework. The Consumer Peer Workforce Committee has over the last year and a half continued to progress the work on the previous committee and build upon these directions. In 2021, we welcome representatives from the 3 specialty health networks, St. Vincent's Health Australia, Sydney Children's Health Australia, and the Justice and Forensic Mental Health Networks, to boost the diverse representation on the Consumer Peer Workforce Committee. There has been strong interest in these specialty health networks, and we are glad to have 2 dedicated workshops from these areas to learn more about the great work that peers continue to progress in these settings. In addition, the Consumer Peer Workforce Committee has represented the peer workforce at a national level and has been involved in consultations towards a national peer workforce framework that will help unite the states and territories in Australia, drawing upon the collective knowledge and wisdom of peers. The CPWC has continued to build upon existing relationships with key stakeholders over the last year and a half, including the National and State Mental Health Commissions, Agency for Clinical Innovation, Mental Health Branch, Mental Health Review Tribunal, and BingF. We hope to continue to strengthen these relationships in the years to come. A peer workforce needs analysis was conducted in 2020 to better understand the needs and challenges of the peer workforce through an inter-LHD Specialty Health Network survey, and the information continues to help to shape the work of the committee. Navigating the mental health strategic organizations and relationships with key stakeholders can be a time-consuming exercise. However, the Consumer Peer Workforce Committee understands this and has created a friendly resource to help explain these relationships, which will be provided to you at a later date. Special thanks to Travis and the CPWC exec for creation of this document. The Consumer Peer Workforce Committee is where it is today based on the strength of the contributions of its members, and I would like to share the credit for the accomplishments with those who have contributed so vitally. As we name people in the rest of the speech, could they please stand or raise their hand as they prefer? The Consumer Peer Workforce Committee has continued to invest in the annual data collection and maintenance of the Peer Workforce database in New South Wales, which helps to link peers from different professions, as well as maintain an updated member list for the Consumer Peer Workforce Committee newsletter. Thank you to each organisation that continues to help obtain this critical data for the peer workforce. The database has led to more frequent newsletters this year, and I'd especially like to thank Brooke Robinson, William Woods, and Travis for the work on the newsletters sent out this year. Do you want to just raise your hands, Travis and Will? Thanks. I would also like to acknowledge the other Consumer Peer Workforce Committee executive who contributes significant time and energy to help the committee run smoothly. Thank you, Christine Love, Deputy Chair, who's unavailable to make it here today. Brooke Robinson, the Deputy Chair, who's away at the moment. Andrew Padiaki, if you wanted to raise your hand. Thanks. And Naomi Roque, the core secretary as well, for all your work. Another thanks to the Consumer Peer Workforce Forum Planning Committee members. And if we'll just read them all out, if they wanted to stand or raise their hands accordingly: Jemima Esbester, Nicholas Caceres, Ashley Reynolds, Richard Brown, Brooke Robinson, Andrew Padiaki, Naomi Roque. Thank you for all your work. As well as the Ministry of Health representatives, Jennifer Montgomery, Dea Henkel, Irene, and Bing, of course, for the staff who've helped to bring this forum together. Thank you for all you've done. In 2020, the departing CPWC exec members contributed an equal and vital role in the role of the Consumer Peer Workforce Committee. Thanks to Nicholas Caceres, Deputy Chair, and Belinda West for everything. Thanks, Nicholas. But personally, having recently completed 5 years on the Consumer Peer Workforce Committee executive and serving a second term as chair, I would like to thank you for allowing me to help to steer the direction of the committee. I'm extremely proud and humbled to be able to draw upon the experience, wisdom, and diversity of the peer workforce to help to bring together this community of practice. Thank you for this opportunity. Finally, the Consumer Peer Workforce Committee owes a great deal of gratitude to the ongoing support of Ministry, especially Julia Smells, the Principal Policy Officer, and Dea Henkel, the Statewide Peer Workforce Coordinator, for the administrative support, guidance, and assistance with peer-related matters. Dea has provided instrumental assistance at Consumer Peer Workforce Committee meetings, general guidance, and just the way you carry out your work with diplomacy, tact, and grace. Thank you. And I'd also like to thank Joanne Ree, who has provided exemplary secretariat services to the peer workforce and brings a cheerful, warm nature to the committee. We're extremely grateful for Ministry of Health helping the Consumer Peer Workforce Committee through the significant secretariat support. We would also especially like to thank Bing and their CEO Irene for their work in pulling together the forum in trying times and all the liaising, collaboration, and work between our organizations. A big, big thank you to you and your team. And the final thank you goes to each of you for the tireless work you do every day in the lives of consumers to make a difference. I hope you're all as extremely proud of yourselves as we are of you. We hope you enjoy the conference, keynotes, workshops, and entertainment. Please get to know one another and continue to create the welcoming, warm, nurturing environment that brings out the best in one another. Enjoy the forum, and thank you once again.